Being a nurse, and I was in Tallahassee as a state representative, only nurse in the House, and now I'm in the Senate. It's two of us senators in the Senate. You know, Senator Grimsley and I, but she's leaving me next year, going to agriculture, so I will be by myself. So you do need me, so I will be your right hand for sure. So, but anyway, with that said, before I start, I really want everyone to introduce themselves, to tell them who they are. But let me start first with my intern. This is my intern from Barry University. I will let her, you know, she just started with us Monday, and she's doing an internship in the office. She met me in Tallahassee. So can you please introduce yourself, my love?
Yes, my name is Melanie Gomez de Rosa. I'm an undergrad student at Barry University. I'm majoring in pre-law, so I'm going to be graduating in a year from now. But I wanted to thank Senator Campbell for actually taking me in as her intern. I'm really excited for the journey that is for me in your office, and I hope I get a lot of experience as being your intern.
Well, you started today, you see that?
Yeah.
Look at the big experience for you. So maybe you might do medical law.
Maybe.
All right, give her hands, please. Because she's an intern. You have to encourage them to finish.
And my name is Jennifer Leslie. Actually, I studied in England. I studied in London, England. I was first a registered nurse, and then I came to the United States and I studied at Florida International University, Bachelor of Science in Nursing, and then I went to University of Miami School of Law and graduated with the Juris Doctor degree. And then after that, I went to Florida International University again and studied Master in Public Health, and that is where I met Dr. Arrieta. He was my professor, very brilliant. And
Thank you.
I'll go to...
And now you are chair for, you know, healthcare task force. She forgot that little piece.
Thank you. Thank you for having us. My name is Dr. Katherine Ntekim. I'm a family nurse practitioner. I graduated from the University of Miami. Currently, I work with BSO, the clinic in the Broward Sheriff Office. And I am very happy to be here and learning a lot from this great lady. Thank you for having me. And the senator has been a big supporter of our team, and we are proud to be a member of it.
You are the vice chair or
I'm
co-chair?
the co-chair.
Come on, don't miss that little piece. Marjorie?
Yes. Good afternoon. I'm Marjori Paul. I am a practicing nurse practitioner, currently working with a pulmonologist up in Hollywood. For the health task force team, I am one of the vice chair and a public officer. Thank you.
My name is John Swan. I'm a foreign physician from Dominican Republic. It's been 5 years ago. I'm really happy today to be. Thank you, Marjorie and Sir Daphne, for the opportunity. I'm very happy to be here.
Are you the co-chair or vice chair?
So he's
What
in
is
the
your name?
community outreach
Coming
team.
out.
Our community outreach.
My name is Joseph Cadet. I study in Faculty of Medicine and Pharmacy in Haiti, and also in Chinese Acupuncture Research Foundation in Taiwan. Also at the University of Miami, where I got my MBA in Health Administration. I'm currently adjunct professor of USAT, University of Science and Technology, also a diplomate for the Faculty of Medicine of Haiti, and also I'm the medical director of the Wellmax in North Miami Beach, and I have 2 offices, one in Delray Beach and one in West Palm Beach.
Awesome. You have any videos?
Good afternoon, everybody. My name is Lee Ambrose, and I started with Senator Campbell as a volunteer in her campaign, and I'm still here, and I'm so glad to be part of this.
You are from Barry.
And I am from Barry University. I am majoring in biomedical and hopefully graduating in 2 years.
Awesome.
Very nice.
Director for culture.
Good afternoon, everyone. My name is Micaelle Titus. I am the chair of the Sports Culture and Special Events Task Force with Senator Daphne Campbell. I am also the former manager and minority AIDS coordinator with the Florida Department of Health. I worked there for 10 years, and as recent as November 2016, I took a leap of faith and resigned, and I started my own organization called the Community Health and Empowerment Network. And so we are working in the community now to be able to provide, to help reduce the health disparities that are going on, and especially with HIV/AIDS, and of course all the other diseases that were mentioned here this afternoon. So we are based in Miami Shores, and our goal is to provide screening services to be able to identify issues early so that we can link folks up to, hospitals and community centers like yourself in order for them to get reduced care, reduce their risk and the lifestyle they're living. So I'm happy to be here. Thank you. I'm an honorary member of the Health Task Force as well.
Good afternoon again. My name is Hudson Robillard. I am a Florida CPA by profession, and I graduated out of Florida International University. I did both my bachelor's and my master's studies there. I started my career in public accounting back in 2004-05 with firm Morrison Brown Huggies & Farrell, which is a very well regional CPA firm. Worked there for like 9 years. Specialization was mostly financial institutions, audits. Did a few due diligence projects, special projects here and there, mergers, acquisition, and all that. And currently I serve as the managing director of my own firm, providing financial management and tax advisory services. I am obviously very honored to be serving as the president of the Citizen Advisory Board along with Senator Campbell. It's truly a pleasure to be here again. Great job, guys.
I'm Desiree Sebastian. I have a degree in Health Services Administration from Florida International University. I have my master's from Nova. I also have a master's in business. I have been in healthcare for, 25 years. Started here. My first degree was here in radiology at Sinai, long time ago.
So you have a lot of alumni here.
A lot of alumni. I have been involved with elder affairs and working with the community, and I'm very privileged to be here, very honored to be with such great colleagues in bringing forth the community health issues. I've been in geriatrics. I work for the Plaza Health Network, so I'm a regional administrator there, and I'm very, very proud to be here and to help the community and reach all its agenda in improving the goals and the health of our constituents with Senator Campbell. Really believe in her.
I'm Alejandro Arrieta. I lead the Research and Recommendations Committee here in the task force. I am a faculty at the Florida International University. I have a PhD in economics, and I focus on healthcare, health economics. Before FIU, I was in Indiana University, and I studied my PhD in Rutgers University.
My name is Adeyinka Abolari. I graduated I started from Miami-Dade, in which Ms. Jennifer Leslie was my instructor. Then I went to University of Phoenix, I gave my master's in education. And I went to University of Massachusetts and gave my nurse practitioner. So I've been an adjunct faculty for Novas, Miami-Dade, and Kaiser. I'm part of the research team committee, and I'm willing to do as much as I can do for our Senator, Ms. Campbell. And also, I'm a director for Women Empowerment Organization in the community. We go to the outreach centers and we provide charity cares and do what we call cover girls, be a mentor to the women in outreach centers, both in Dade and Broward.
Awesome.
Hello, my name is Elizabeth Honorary. I'm also a very good employee of Senator Campbell. I have been working for the legislature since 1990, and this is my fourth member. And working in the Senate, in the House, and the State Attorney's Office, as working for Mr. Satz, as helping with criminal justice, my major in criminal justice, and also a business at FIU. And I serve as the Chief of Staff in her office, starting in November when she became Senator in the District 38. And I am very involved in the community. I'm also, my home is also in here. I used to come here. My first child was born here, and my husband had a defibrillator here, had a heart surgery right here at Mount Sinai. So I'm very passionate about this hospital, and I do love Mount Sinai. You guys have great care here, and you do a lot for the community. And I'm very humble and very happy to be here to serve as District 30 District Chief of Staff to help in the community and what we have to do to help our citizens. Thank you so much for having us today.
Thank you for being here.
Come on, communication media.
Hi, Franz Micaelle. I'm not a Berry grad, Nova, or FIU. Well, I started at Kaiser, but I decided that I should drop that to actually pick up a weapon to defend this country. And then I switched over from the Marines to go to the Air Force, where I graduated from the Air Force College, because you have to actually have a degree in the Air Force. So I ended up getting 2 instead of 1, and I'm a web developer and a webmaster. I have a degree in IT and international studies. So kudos to the Berry people, kudos to the Air Force College.
What about the books?
And also, I'm also a published author. I have 4 books published, and I have 2 more coming also soon.
Awesome, awesome. Come on, my cameraman. My cameraman.
Oh, wow. I'm Kirby Levey. I'm director of a television TV station in Miami, Teleana Kawana. And I got a master in computers. I'm working for Miami-Dade County. And I like what I'm doing here. To be a cameraman.
Yeah. So basically, you try to tell the CEO once Mount Sinai wants some communication outreach out there, they could call on you. All right. You see, I bring you everything.
So hello, I'm Stacy Kilroy. I went to Gables High. Yay, go Cavs. I'm the Director of Planning and Government Relations for the Medical Center. It's a really big honor. Thank you very much for bringing all this information to us today and all these resources. And I am also involved in the same things, so I'm very thrilled. Thank you.
In fact, I have worked here, and our Honorable State Senator has worked here. In fact, it's so special to us because we actually met here at this hospital. And that was in the 90s. So that being said, that is the reason why this hospital is so special to us, and this is the very reason why we're choosing your hospital, our hospital, as the first hospital to do our Senatorial Walk. Now, this day is very special, and we named it Senatorial Walk for Health. So we're very honored that you're participating in the Senatorial Walk for Health. And I would like to introduce you to my team, and I'm going to start with co-chair Dr. Katherine Ntekim.
Good afternoon, sir. Good afternoon. Nice to be here. I too have worked at Mount Sinai.
Oh, very good.
The beginning of my nursing program was at Mount Sinai. We sort of had a little bit of a survey as to the different community health problems that in the district. And along with Desiree, we compiled a little speech, and I'm going to let her go ahead and talk to you about it.
Hello, Mr. Sonenreich. I'm Desiree Sebastian. I'm also part of the Health Task Force. And some of the common health problems in District 38 that our surveys have some of the information that we've gathered is the Health Council of South Florida prepared a community health needs assessment in 2015. They concluded, just like in 2013, that Miami-Dade County Health Needs Assessment Survey, that there's an overwhelming factors and disparities regarding health problems in the district: heart disease, stroke, and cancer. They also concluded that the health community diseases such as HIV and AIDS, hepatitis, and a host of other health concerns in the mental health area impacts the delivery of services in the district. Our health task force recently completed provider surveys indicating that there are multiple factors, that these are providers that have said that these are the things that they feel are barriers that impede the care in the district. They showed social, economic detriments of health, such as education, social support, as an impediment. They identified the uninsured and the underinsured population, especially in relation to the American Health Care Act, for reasons for poor access. The survey also identified poor compliance to treatment of chronic diseases due to lack of disease management in the community. Those were our findings.
Some of the common health problems that Desiree has indicated makes for a multidisciplinary approach to to increase access and high quality care delivery. In order to decrease the morbidity and mortality in the district. It involves also informing and empowering the community through the hospital program's wellness. We do know that you, as from our research, is very welcoming of partners who wish to participate in joining to improve the healthcare of the community through technology and cutting-edge research, while providing a world-class care environment from knowledgeable and compassionate professionals. We, the Health Task Force, thank you for giving us this opportunity, along with our Senator, for this opportunity. Thank you very much, sir.
Thank you for being here.
Awesome.
Thank you, Dr. Ntekim. We have just excused Dr. Jodeline Turin. He worked as a team with Marjori Paul, and so next Marjori Paul will introduce herself and talk about some other issues that the community faces.
Okay, good afternoon.
Good afternoon.
Mr. Sonenreich and Stacy. Thank you so much for having us here today. On behalf of our Senator Daphne Campbell, I want to personally show my gratitude to you answering to my emails, especially when I started the whole process for this. Thank you for taking us in and clearing your schedule for this afternoon to really give us the time and the opportunity to go over a few issues and a few things with you. I also want to say a big thank you to Ms. Priscilla Friedman. I met her earlier, but she has been so instrumental in getting this scheduled, taking care of us scheduled without delay, and I just want to commend her for that and say a big thank you to her. Now, I know that hospitals, all hospitals generally, play a big role in taking care of a lot of the low-income residents, especially in District 38. That doesn't make any difference. Mount Sinai, being the only hospital really in the beach, has definitely sustained a large amount of residents of the constituents that are in the low-income pool. Based on some research that I was making on Mount Sinai, I do see that Mount Sinai has had the lower end of the spectrum when it comes to reimbursement for the low-income pool that was actually an extension of the Medicaid components. And as I was looking, I see that we only have Mount Sinai as a share of cost. The percentage is about 2.40%, putting it in the tier 4, meaning that it's really not getting that much for patients that they see that are in the low-income pool. So I'm not sure if this has a lot to do with it being a private organization, a non-profit organization, as opposed to the other public organization that are making that are getting a higher reimbursement, like the Jackson Memorial Hospital, which are in the public trust. So I'm sure that with that, even with all the difficulties in reimbursement from the state, from the federal government, Mount Sinai has always opened its doors to everyone, and everyone has been welcomed, no matter what level of poverty level that they fall into. So I actually wanted to commend Mount Sinai for always opening their doors to everyone, no matter how much money they make, their income levels. And that has been something that comes from the leadership, of course, treating everyone equally and giving everyone the benefit of the doubt and taking care of them. So we salute you for your leadership and we thank you so much.
I'm glad that you noticed that disparity in terms of our reimbursement.
Yes.
And it's really unfortunate, and I'm glad that you brought it up. And there should be no reason for that. It's really, we're being reimbursed at an unfair level compared to others. And we are a 501c3 tax exempt organization, and our reimbursement for charity care should be on par with other hospitals who do the same.
Definitely.
But thank you for recognizing that.
My pleasure.
I will work on it.
I know you.
When it's my time, I will tell you.
I know you.
Next, I would like to introduce to you Alejandro Arrieta. Dr. Alejandro Arrieta, excuse me, where are you?
Right in front of you.
So quiet and humble. And in fact, is an expert in the area. He has been guiding our research activity within District 38 and this team. And he has a demonstration or a project that he has been working on, and he's going to sort of put forth that to the entire team. Talk about that now.
Thank you. So I was invited by Jennifer actually to be part of the task force, and I want to start saying that it was a surprise because I think everybody agreed, right? And you mentioned that in the morning. One of the problems in the Senate is education, how to educate our senators, right? How to, senators can make decisions based on evidence. And I think your step of creating this task force shows first that you are smart because because you know that you need to listen and make bills based on some evidence and some support and at least some evidence, some research. So that's what we are doing in the committee, on the research and recommendations committee. And the approach that we are taking is basically looking at the community and how to engage different partners in the community in order to improve the care, the health of the status of the community. And the approach we are taking is basically looking at evidence, right? It's data that it's available for zip codes or from hospitals, like hospital readmissions. And I think you mentioned this clearly. What is happening in District 38, which we're part of District 38, and you can see the big disparity again, right? 3 zip codes where this is admissions of asthma in children in particular. And you can see that there are zip codes where the admissions are huge, right? Rates of admissions to ER are huge, and that affects, of course, hospitals, right? And that's related to what you were talking about. And it's growing, right, in those areas. And so I think what you have here in the hospital is that situation where you are serving a very, very poor population and at the same time a very wealthy population, right? Those two populations completely different at all disparities. And the question is, how can the hospital engage with the community? How can we identify key partners in the community to improve the health of this District 38 and in general in Miami? So data is one step, like this type of information on the service that we are doing to providers, but also I think it's more important listening, right? And listening to the community, and we are doing a town hall, a healthcare town hall, to listen what is the perspective of the people, right, the citizens. So for example, in the surveys, we find out that hospitals said, well, one of the problem is that patients are not taking their medicines, adherence to medication. Some people say, well, that's a problem of education. But when you listen to the community, well, they have a different perspective, right? Maybe they don't have access, right, to the hospitals or to the community. So we want to listen and suggest decisions. So maybe I can ask you, and I actually read you know, the information that you get from the engagement that you have with the community that is part of the ACA. So I would like to know what kind of partners you have and what kind of work are you doing with the community, engaging with the community? You know, maybe we can learn something together, or even, you know, what can Senator do in order to improve that partnership?
Well, first, thank you all for being here and welcome. I think that the biggest challenge in healthcare, and in terms of individuals who are challenged with access. So we're not really talking about you know, very wealthy people and very poor people. We're talking about people having access to healthcare. So it's really about people having access to healthcare. So it's about people having, I would say, you know, adults and children having a primary care physician and having that relationship. So regardless of what zip code you live in, the most important thing, you know, is for people to have their own primary care physician, for adults have a primary care physician. And obviously for women of childbearing ages, to have access to an OBGYN, and for children to have access to a pediatrician, and for people of all ages to have access to dental care, and have and then for those people who are challenged with chronic disease, diabetes, hypertension, and other chronic diseases, is that they have access to a healthcare navigator, somebody who does their best to help that person manage their medications, manage their socialization, because so many people who don't have means do not have access to socialization, which is important, and has access to transportation. So it's not about hospitals, it's really about having primary care centers that are able to be right-sized throughout the community. And we work closely with the Miami Beach Community Health Center, which I think, if you haven't visited them, if they're not on your calendar, that should be a place that you need to visit, because that's what they do. They provide access to people who have limited means to primary care, OBGYN, I forgot behavioral health and pediatrics, and they do it well, and we partner with them, and we work very closely with them. And then so that to me is the most important model.
Yeah,
you don't want to try to drink the ocean. You want to try to drink a little bit at a time. But the most important thing for all of us is to have a primary care physician relationship, and for our friends and relatives, obviously, to have the same. And then there's a physician shortage. And so one of the things that we're working on, collaborating with Miami Beach Community Health Centers, is developing a OBGYN training program and a behavioral health training program, because we want to produce more primary care physicians and OBGYNs and more psychiatrists. 1 out of 4 people in the country has a challenge with mental health. There's a tremendous shortage of mental health professionals, tremendous shortage. And when you hear about opiates and other addictions that are challenging our country and at every level, what's a behavioral health problem? When you talk about obesity, there's an aspect to obesity that is behavioral. And so if I were to recommend to the senator and to others, the key to enhancing healthcare in the community and diminishing disparity, it's all about primary care medicine and having the access to those services for the various populations. And that doesn't exist right now. Would you agree with that?
Not only we, I think, there is a survey from many hospitals concerning the same drivers, access to care, preventing and screening, which is
But it starts with having a physician and a relationship with a doctor. And so, when I meet, many people of all different types of economic capability, rich and poor and middle class, and one of the first things I ask them is, do you have a doctor? Right? So
no insurance,
so, excuse me?
You don't have no insurance.
No matter what, whether they have insurance or don't have insurance, right? So how many people in this room, let's a show of hands, everybody, how many people have a primary care physician?
I do too.
I work for the state, I
You're
have to have
asking
one.
the wrong group. So what do you mean the wrong group? Why is this the wrong group?
Yeah, because we all have insurance.
You all have insurance?
I think so, right? Yes, I mean, and we all have a primary care physician.
Right.
By the way, Mr. Steven,
So
before
we
you
need to have
continue-
more people have insurance. Right?
Yes, right? She's from Barry. You don't have insurance?
Yes, I do.
If you don't have one, Mr. Steven gonna give you one.
I don't know about that. I think the senator is in a better position than I am. So
give her one.
Right. So it's it's a matter of we can have all the charts and everything. It's about people having insurance coverage and having access to primary care.
And that's a new challenge right now.
It's a new challenge?
It is a bigger challenge now if Obamacare is repealed, things are going to get...
But why is it going to be
tougher,
repealed? It hasn't been repealed.
Well, if that happens, right? May happen.
It's in the process. It's in the process.
Right, but you need to make sure that it doesn't happen.
So that's why we want to work on it.
I mean, that's the key.
It's a tough proposition given the current political climate. Obviously, the Congress, House of Representatives, congressmen and women over there already voted their own bill. Obviously, their version of the bill is in the Senate, your Senate, so we don't know what they're going to do. If they adopt it or they write their own rule and go to reconciliation, what can we do? They're a majority right now. So we can continue to fight, but then it's in the process.
Right. But everybody in this room is politically involved, right?
To some degree, yes,
To
right,
some
Senator?
degree. So everybody is politically involved, and so we all know what needs to be done, right? It doesn't take a lot of research.
Well, one of the things that we also have to do is to prepare, right? Under that scenario, if that happens, like what we are trying to do with this task force, right? How to connect with the community, how to prepare the community, how to strengthen the community. So we were curious about the partners that we have, and for example,
So the partners that we
the
have,
schools,
first off, we take care of everybody. So we take care, 1 out of 4 people in Miami Beach do not have insurance coverage. We take care of everybody who comes in, and everybody knows that. Plus, we train a lot of physicians. Many of the physicians in our community are people who trained here, many of the nurses, and other pharmacists and therapists. And, we train a lot of people. We certainly do our share. And primarily, we partner with the Miami Beach Community Health Center because we have the same mission, which is to take care of people who are less fortunate. And they have primary care centers in the community. And I think that we just need to make sure that there are more of these centers that are developed. They do have access to funding. They have access to federal
I get
funding.
money, I will talk about it.
They have federal funding.
Yes.
You know, and then, institutions like Jackson, as you know, have, also have significant funding. And I'm sure, are, running, healthcare clinics in your community, aren't they? So,
Yes.
I mean, that's the key, is to have as many primary care centers as possible.
It's a crisis.
Isn't that?
It's a crisis, but when it's time for me to speak, I will explain you how I
Very
help
good.
you.
It's always
in
time for you to
Jackson
speak.
and I will let him
They
speak
know,
and
they
finish
know. They know, right?
agenda. I follow through.
But that's our position.
Right, right. No, I think I just want to finish saying that it would be great to be connected with you later and to explore other options in which hospital
Sure.
the hospital can engage in.
Right, so it's not a hospital issue, it's an outpatient.
It's not a hospital,
community
it's
health
a
issue.
multiple.
Right, so our role here is we run a hospital.
Right.
It's pretty hard, difficult job as it is outpatient. Public health is a different specialty.
Yeah.
And so we play our role. I always tell everybody here, regardless of what your role is, whether you're a nurse or an accountant or a researcher or a physician or a pharmacist, everybody needs to play their role and play their role to the optimal level. So we play our role is being a great hospital, taking care of a lot of people and training people, and then working with the various community health centers to provide access to high quality care. Right.
Next, a very important person that's here today, the president of the Senate District 38 Health Task Force, Mr. Robillard Hudson.
Thank you very much. I'm not sure if you wanted to get Dr. Katherine to speak, because after I speak, I'm going to introduce Senator right there. I don't know.
If he wants to say something or add to what you have to say, that is fine, or
Okay.
if you would like to speak instead.
Sure, because I'm going to.
Yes,
Sure.
my name is Dr. Joseph Pierre-Paul Cadet. It's such a pleasure to be here today.
Thank you.
Senator Campbell, I'm very thrilled to be here today. And I was the former president of the Haitian Medical Association abroad. And to make it very brief, we have been able to identify some of the problems, in the community. Like most of you already mentioned, like access to care, the quality of care, the access to care, like you mentioned before, due to the physician shortage, that it's understandable. The quality of care, because a lot of people, like most of you already mentioned, they have a limited coverage with the insurance or the lack of. And also we're talking about costs, the cost of, giving care to the patients. We also identify, the term disparities, has been around for so many years now, and we've been working so hard to make a difference in the community. So we kind of put some patches, somewhere. Like we have to go with the radio program, try to educate the patients, and some health fairs, like you mentioned. We all know that in this community, a lot of patients they're facing, high blood pressure. They have high blood pressure, diabetes, metabolic syndrome, and substance abuse. It's very, very, current in this community. So the action of the medical association is not, being a very great organization of more than 4,000. So we're trying to cover here and there, what we have in different communities, like in Florida, New York, New Jersey, Chicago, Maryland, in Montreal. So not only we try to cover, problems in this community, we extend our possibilities even through Haiti, because we have to help there also, because some of the problem that we have in the community, we have some kind of, duplication in Haiti, I can say. So that's the reason why, we are trying with the health task force to see if we could help also. So we understand that Haitian, they like to use the services from Jackson Memorial Hospital, North Shore Hospital, and other part of the community as well. They go to Baptist Hospital, South Miami, and Camden Hospital, and that's the reason why we really appreciate the fact that a lot of Haitians, they come to Mount Sinai, and thanks to you and your team, so we want to extend a very great thank you to you, sir. Thank you very much.
Thank you.
Once again, I gotta say special thanks to Mount Sinai Medical Executive Team, the President, CEO, Stephen Sonenreich. I want to make sure I get the name right, and also special thanks to the hospital executive assistant, like Marjorie said before. There were a lot of coordination, and we truly appreciate the opportunity to be here. The executive assistant and staff, Miss Priscilla Friedman, just want to make sure I say her name, that she get the recognition she highly deserved. Obviously, special thanks to the Healthcare Task Force team, Florida Senate District 38 executive team. Let's start with Jennifer. Thank you for your leadership on this and part of making sure this is happening, not just at Mount Sinai. Obviously, we are just getting started in terms of the overall goals and objectives we all set out from the beginning. Co-chair, Dr. Katherine Ntekim, thank you again. Marjorie, Vice Chair, you all deserve a round of applause for your extraordinary effort. My name is Hudson Robillard. I heard you said accountants before. I happen to be a Florida CPA, practicing as a financial management advisor, tax advisor as well, and happen to work very closely with Senator Campbell. And I do serve as the president of the Citizen Advisory Board for Florida Senate District 38. Just to give you a little quick recap, on January 12, when Senator opened the office in the district, January 12, 2017, she pretty much laid out a very strong foundation in terms of how she sees the district. And a preliminary assessment was that there's so much that needs to be done throughout the district that herself and 2 or 3 staff, so there's no way they were going to be able to go through all the motion of the thing. So we pretty much sat down and identified 12 different areas, because what you're seeing here is just a healthcare team, but then we were working on education, affordable housing, climate change, environmental issues, sports, culture, and special events task force. So there are a number of things that are happening through Senator's leadership. And again, this is an example of what you're seeing here through the Healthcare Task Force. Thank you for giving us the opportunity to discuss health-related topics, as well as, obviously, we talked about Medicaid, nurse-to-patient ratio, community-based programs that may decrease readmission rates, unnecessary ER visits, just to name a few. Obviously, none of the things we are doing today would have been possible without the leadership and vision of the great individual who's our senator for District 38. Personally, I have never seen anyone care so much about the community, the people, the institutions, truly, that makes the fabric of our cities, all the 15 cities and towns that Senator represent, our counties and our state, the state of Florida. As a first-term senator, I got to tell you, by all accounts, and I go to Tallahassee last time and I've talked to a lot of people, she's been magical in terms of the things that she's been able to do, whether it's dealing with fellow lawmakers, maneuvering the budgetary process to get a number of projects for her district on the state budget as we speak right now. She's been there, and including whether it's meeting and visiting people and institutions in the district, institutions such as Mount Sinai Hospital where we are today. She's been nonstop, and because of one thing, she cares, and we all know that. Well, with all that said, I want you all to join together and put our hands to welcome our Senator Daphne Campbell.
Well, thank you, my president for Citizen Advisory Board, and I could say Mr. CEO Steven. Again, I thank you from the bottom of my heart for even take your time, because I know all CEOs very busy. But once I believe Marjori reached out to your office and your staff work tirelessly and professionally to make sure this happened. And I'm very, very pleased, and I'm going to give you good news. And after I give you good news, you're going to adopt me. It's an honor for me too. And I know you are very, very busy, and I really, really congratulate you for all you have done for this community and for even accepting us to come and speak to you. But the good news, in Tallahassee for past 2 to 3 weeks, with all the fight between the Speaker of the House, the President of the Senate, and the Governor, and you do have a lobbyist for Mount Sinai who came to me, that's in the last day of session, last day, and bring me where Mount Sinai was losing $4 million. I gave you a copy of it, right. And I was able to sleep in front of the president's, the Senate president's door, yes, 2 o'clock in the morning, and make sure you got your money back. So I have done this. You see it? For Mount Sinai. Sure. Exactly. So that was a big thing. So because I know Mount Sinai, you need the money because you've been helping a lot of people who don't have it, indigent, underserved people, low income. So I know you need the money. So I am here just to let you know I am here for you in Tallahassee. You do have a voice, a strong voice, and who work very close with the Republicans, because over there is majority is Republicans. If you don't know how to cross the aisle, you won't get anything. And I heard you mention you work with Miami Beach. I got them in Tallahassee $200,000 this year to help them serving people who don't have it. They did request $600, but I was fighting a lot, but I got $200. So what I'm here to tell you, for now on, Mount Sinai won't be, struggling for money. You could talk to your crew, your people, who represent Mount Sinai in Tallahassee, and I will continue voicing for Mount Sinai. Mount Sinai will be the first on top of my list for next session.
I bet you tell that to all the guys.
No. I represent Mount Sinai. Give him the video. Mount Sinai and Jackson, all of them is, how many hospitals I have?
We appreciate your being in Tallahassee.
And if you see that, I voices for Jackson as well, and Children's Hospital as well. Miami Children. All these 3 hospitals. Jackson was losing $72 million.
Yeah. Jackson did better than us.
And then you did. But yours was.
Miami Children's Hospital did better than everybody.
They were 39. No, but
I want to get to the top of your list.
No, listen. I am on top of your list. But when I'm saying.
No, I know you're on top of my list. I want to get on top of your list.
Okay, but you're gonna be on top of my list today. Okay. But you've been on top. You've been on top of my list because I was in front of the president, Senate. My staff was there to make sure. So
I'm not kidding, but I'm being just.
But I'm there for you.
Thank you.
And
Thank you
before you leave, and this is a token of my appreciation for the work you do here as a CEO. And I do have a proclamation, and I did for you on behalf of. Right now it's 38 of us in Tallahassee, 38 senators. You know that because we have one who's sick with cancer, but she's doing well. And one with the issues, you know that. So it's 38 of us. And myself, Senate District 38, my staff, and the entire team of Healthcare Task Force, we appreciate you.
Thank you.
We congratulate you. And I thank you for everything you do. And we thank you too for taking care of those who don't have it. And for the constituent here, your patients, and the care you guys give at Mount Sinai. I never heard anyone for 6 years in office, now first time ever senators, Haitian senator in the state of Florida. I'm the second African American senator in Miami-Dade, and I'm the second. We only have 2 black women. I'm one of them in Tallahassee. I'm honored, privileged, and humbled to serve, and this here is a token of what you do for the Mount Sinai Medical Center.
Thank you very much. Thank you.
Can everybody copy of the tape, and after they edit everything, and you get a copy as well. Everybody circle the CEO, Stephen, please.
Is it good enough for? Yeah.
This is my first proclamation.
I will.
From the Senate to you.
Very good. Thank you.
Me.
That would be great to have. You
got 2 more. It makes me feel like a celebrity.
Everybody got your book? Give it one.
That's my book. Very well educated for your masters. Thank you,
Doctor. You get one. Okay.
Turn to the right-hand side is the nursing office. That's from the research.
Oh, I'm going to have
She should be there.
Oh, okay. She's in the administration now?
Yeah, she's a vice president.
The person underneath Marjorie.
Are you serious?
Yes.
Oh, I want to see Marie. She's on the first floor?
First of all, when you get down in the elevator, you go to the right, in the nursing office, she's there.
Okay, I'm going to go.
Okay?
Is that where we get tickets validated or
Yes, I'll have it seen her for.
validated?
I was the one who gave me every penny in Tallahassee for Haitian community. I bring every year a lot of money. A lot of money. I'm a queen of money. But I was a state representative. The Senator Garcia always made sure I got every penny. Now we are together. But he's leaving me next year. He's not leaving because he is
I'm sorry.
he is termed out, but he would be my next yes man.
All right, put a smile on the face, please.
One more good. There we go.
Don't worry, be happy.
Yeah. It went off, Micaelle.
Yep. Here.
Micaelle is going. It was that. It just went off. I'm taking so many pictures.
I was the president for my citizen advisory board.
It's a lot of work that we're doing. We taking out this very
Tell us a little bit about me for 6 years.
Yeah. I know, right? Well, keeping up with her as a child.